Extreme heat is a worldwide problem.
Excessive heat stress can directly compromise human health, safety, and productivity.
Blood volume is getting affected, salt and water losses.
Complications associated with dehydration, rises in core temperature, which lead to heat exhaustion or heat stroke. If you have an underlying infirmity, that can prove deadly if you have cardiovascular disease. Extreme heat can be very detrimental for the health of pregnant women and their babies. There are age-related decrements in the ability to thermoregulate, primarily through sweating. So if you're living in low-resource environments, if you don't have access to air conditioning, the impacts on human health there can be quite substantial.
It's very, very applicable in Namibia as well as Nigeria. Temperatures of 46 degrees centigrade or higher are recorded now, especially perhaps because of global warming.
In this area, there's a dry heat. There is very less sweating. Older people usually restrict themselves to their inside house, and thereby their physical activity reduces, and that in turn bad for their overall physical activity. Therefore sarcopenia and osteoporosis comes into the picture, even if they are otherwise healthy.
People who live in rural areas and rely on subsistence farming. Women who are in that situation and are pregnant are exposed to very high levels of heat stress. This then has an impact on both the maternal physiology in terms of pushing the mother's core temperature up, but we also found indication that this affected the fetus. The solutions to this in this setting are much more complicated than you may think.
Yeah, we cannot just expect broad policies or solutions to save or safeguard humans in this boiling world. We need to be more specific, and therefore the discipline of physiology brings about this key enabler to push our agenda.
We have received funding from Wellcome to run a study to really explore in much more detail around the biological vulnerabilities of pregnancy in terms of their exposure to heat.
I think it's a good idea to also look at the effect of nutrition.
The human-centered approach is really essential, and this is where our understanding of physiology really is a differentiator.
By doing so, understand the mechanisms, it will also ensure more people will be positively impacted with the strategies.
So if we can utilize physiological knowledge to enable people to optimize comfort, reduce rises in thermal strain, but at the same time do it in a way in which does not require a great deal of carbon, then that's really an ideal solution. So if we think about the types of low resource strategies that people should be using, the answer of which one would be optimal is based on the climate, but it's also based on the physiology.